The U.S. healthcare system isn't just sick, it's in the ICU. We're bleeding $4.5 trillion a year. That's more than the entire economy of Germany. And for what? We die younger than people in Slovenia. It's a bureaucratic horror show wrapped in a lab coat. But quietly, in server farmed and research labs, a new kind of doctor is clocking in. One that doesn't sleep, doesn't get burnout, and can read 10 million medical papers before its first cup of coffee. This isn't a future promise. This is a hostile takeover of inefficiency, and it's happening right now. First, let's autopsy the patient. The American healthcare system is a masterpiece of bad design. It's a Rube Goldberg machine made of billing codes and prior authorizations. We have a doctor shortage barreling towards us like a freight train. 124,000 physicians gone by 2034. The ones left are drowning. They spend 2/3 of their day not with patients, but playing data entry clerk in electronic health records. It's a soul-crushing, multi-billion-dollar waste of human talent. Meanwhile, medical error is the third leading cause of death. This isn't a system. It's a sanctioned catastrophe, but the code is finally being rewritten. Let's start in your pocket. You feel like crap? You open an app like Babylon Health or Ada, you cough twice into your phone. In 30 seconds, you get a verdict. Not from WebMD hell, from an AI trained on 300,000 cough samples. It analyzes vocal biomarkers, pitch, rasp, lung resonance. Accuracy? 91%. That's better than your average GP on a first listen. It cross-references your symptoms with live CDC outbreak maps and your own medical history. Then it does something truly revolutionary. It tells you exactly where to go. Not the slam DR with a 4-hour wait, the quiet urgent care 7 minutes away. Prescription already sent. Cost? $12. This is live in clinics right now. One AI nurse handles 1,200 cases a day. A human? Maybe 40. This is triage without the tragedy. Now, let's go deeper. You get a chest x-ray. The film hits the cloud. Before the rad tech can even spell your name, an AI from a company like Zebra Medical has already read it. It flags a 4mm nodule, invisible to the human eye. It draws a glowing red box around it and gives the radiologist a risk score. 87% chance of malignancy. This is FDA cleared. It's trained on 2 million scans. Its catch rate for early lung cancer? A staggering 93%. Humans, working alone, average about 69%. But this isn't about replacement, it's about augmentation. There are only 34,000 radiologists in the US, and they read over 1 billion images a year. The AI chews through the easy 80%, the clear scans, in seconds. It lets the humans focus on the hard, complex 20%. The result? Productivity up 42%, burnout down 19%. At Mayo Clinic, an AI spotted a stroke on a CT scan in 1.2 seconds. Human confirmation took 12 minutes. The patient got life-saving treatment 11 minutes sooner. That's the difference between going home and going to a nursing home. But the real villain here isn't disease, it's paperwork. The administrative bloat is a $300 billion parasite on the system. Doctors spend their lives as data entry clerks. Enter the AI scribe. It listens to the natural conversation between you and your doctor. In real time, it writes the perfect clinical note, codes the billing, orders the labs. It's all done before you've even stood up from the exam table. One hospital system implementing this gave each doctor back 2 to 3 hours of their day, every single day. That's time for more patients, for actual human connection. And then there's the fraud. Healthcare fraud is a $300 billion a year industry. AI hunts it. The CMS uses predictive models to spot patterns no human could. A clinic in Florida bills for 800 knee replacements in a month, all on 72-year-olds. All on Fridays. The AI red flags it in 0.3 seconds. A human auditor would have taken 3 weeks. This is bureaucracy automated into oblivion. Now, let's talk about the big one. Cures. Drug development is a 12-year, $2.6 billion gamble. 90% of drugs fail. AI just ripped up that business model. The story starts with Google's AlphaFold. In 2020, it solved the 50-year-old protein folding problem. By 2025, it had mapped over 200 million protein structures, the entire protein universe, for free. This is the foundational map for every drug to come. The impact is already seismic. A company called Excentia used AI to design a cancer drug in 8 months, from a blank screen to human trials. Cost? Under $1 million. In Silico Medicine designed a new antifibrotic drug and had it in phase 2 trials in 18 months, a process that traditionally takes 5 years. This means drugs for rare diseases, which were never profitable before, are now viable. That obscure genetic condition your nephew has, a cure might not be a lifetime away anymore. This is the Raspberry Pi moment for biotech. Finally, let's talk about the budget killer: chronic disease, diabetes, heart failure, COPD. 80% of our healthcare spending, and 90% of it is preventable. AI is moving from treatment to preemption. Take Livongo. A smart glucose meter beams your readings to the cloud. The AI notices a pattern. Your sugar spikes every Tuesday after your team's donut run. So on Monday afternoon, you get a text. Hey John, big game tomorrow. Maybe skip the maple bar. Here's a 2-minute recipe for a killer omelet. Compliance jumps 38%, hospitalizations drop 22%. But it gets wilder. Blue Cross Blue Shield uses an AI that predicts heart failure episodes 11 days in advance. How? It crunches data from wearables, weather patterns, and even when you last refilled your prescription. The intervention is automatic: a pharmacy call and a medication tweak. Readmissions slashed by 51%. This isn't healthcare, it's a distributed intelligent health guardian. Now, let's not drink the Kool-Aid. AI isn't a magic pill. The risks are real and terrifying. Risk 1. Bias. An algorithm trained mostly on white patients will misdiagnose skin cancer in black patients 31% more often. Garbage in, gospel out. We need diverse data, or we're baking historical inequities into the future. Risk 2. The data breach of the century. Your genetic data, your heart rate during a panic attack, your prescription history. It's all a juicy target. One hack at Anthem exposed 79 million records. This requires security that makes Fort Knox look like a cardboard box. Risk 3. The de-skilling of doctors. If the AI does all the diagnostic heavy lifting, do we risk doctors forgetting how to think? The answer isn't to stop the tech, it's to mandate the human override. The AI is the co-pilot, the human is still the captain. This is a tool, not a takeover. So, can AI solve the US healthcare crisis? Solve it? No, it's not a silver bullet, but it's the most powerful scalpel we've ever had to cut out the rot. It's a force multiplier for our doctors, a guardian for our patients, a hunter of fraud and a discoverer of cures. It's taking a system buckling under its own weight and giving it a new spine. The future of American healthcare isn't just more doctors and more hospitals. It's smarter, leaner, and ruthlessly efficient. It's a system that finally uses intelligence to actually care for our health. The code is being compiled. The models are being trained. The revolution won't be televised. It'll be diagnosed. So what do you think? Is AI the cure, or just a new set of symptoms? Let us know in the comments. If your mind is even slightly blown, do the AI an algorithm a favor. Like, subscribe, and hit that notification bell.
We're just getting started.